how can we help younger people avoid the situation that we as adults find ourselves in with these tiny mouths and tiny noses and airways? Like, one thing that really is lacking on my channel is advice for mothers in particular
Yeah.
as to how they can help their child not suffer in the way that they're suffering. And
Yeah.
I know that you're a mother,
I am.
so, and that's great. And what advice have you like followed in your? And maybe that's too close to home. Like, but what advice do you give to mothers for raising healthy children?
Sure. And so, you realize some of this is going to be opinion. Having literature to verify everything, I think we're still in the infancy, but there is literature to back up everything I'm saying. And each one of these points we could probably talk on for an hour. So I'll
Mm-hmm.
be kind of brief in my list, but I think it starts preconception. I think it starts, with the optimal health of the man and the woman preconception. In utero, I think everything counts. Everything counts in terms of nutrition, in terms of mother's sleep, in terms of mother's ability to breathe well and to oxygenate well. And then we get to birth, and this is really near and dear to me. When I was pregnant, I was reading every midwife book I could get my hand on. But and when looking back, contrasting our modern lives with our ancestors, today birth, especially in the U.S., it is an intervention. It is a medical procedure. I don't know the stats, but is it a high percentage of births that there is some type of medical intervention. An epidural, a Pitocin drip, some type of forceps or vacuum assistance, or a cesarean section. Those are probably some of the most common ones. I philosophically do believe that we have birthed healthy children for very long time as a human species, and should generally be allowed to do it today, and I think in many cases it's very safe, and so I think being allowed to carry your child until full term, not scheduling a premature C-section at 38 weeks, is something that sets your child off on the right foot in terms of their lung development and everything. So a full-term natural vaginal unassisted birth. And then from there, hopefully, baby is healthy, and right away you can do skin to skin. Baby can start off nursing. Baby, hopefully doesn't have to start off on a bottle or with sugar water or in the NICU. So starting off nursing right away, allowing that proper oral function to develop. In an ideal world, the baby can be breastfed exclusively until it's able to get its nutrition from foods that it has to masticate. So, to contrast that, oftentimes at 4 months, 5 months, 6 months, we start to put rice or cereals in bottles, start to do purees and baby foods and other mushes and mashes. Ideally, we're breastfeeding, and that's where the baby is getting majority of its nutritions and fluids. And then as the baby shows more development, they can handle foods. Like there's a great book on it, Baby-Led Weaning. But they can handle foods, bring it to their mouths, start to gnaw. And with my girls, I did this before their teeth even erupted. They would gum things. I would give them a really soft pear. I would just cut it in half. And they were fumbly. They didn't have great motor skills, but they'd bring it to their mouth and they just gum it and gum it and gum it and suck it. And I think that's a big part in the development of a more mature swallow and really starting to strengthen the muscles of mastication. Kind of moving on, when we get into these toddler years, there's so many sippy cups and, again, little snack foods and tubes of foods and yogurts and Go-Gurts and that kind of stuff. I think then we also need to be conscientious of introducing things that are tough in the diet. And I've had parents ask me for lists, and I'd say, well, I don't know everything, but here's what I did with my girls, and it's working well. I gave them sticks of beef jerky. I gave them raw carrots. I gave them raw celery sticks. Dried mango. I know I'm a dentist, and that's like very high in sugar, but it's tough. I mean, do you ever get those strips of dried mango, and they're
Yeah,
having
from
to
Trader Joe's. Yeah,
yeah.
they're tough and they're also delicious.
Yes. They're really having to incise it and tear it and pull it. And I think all that stuff is beneficial. And there is a fear that children will choke. But I think, if you monitor them closely and they have to learn how to handle these foods. And I think it's really to their benefit. And then always, so my girls are 2 and 4. And they're probably already sick of hearing me say this, but I'll always give them reminders. Close your teeth, close your lips. Put your tongue up. Close your teeth, close your lips. And I think that is so important, just training that habit.
So you're actually coaching them on what we would call mewing at a very young age.
Oh, absolutely. Yeah.
You're
yeah.
telling
I
them.
think
You
the
can't
best
just
habits
rely.
start young.
Sure, and it doesn't always just happen naturally. Using verbal cues or just giving the command to a child, hey, seal your lips, put your tongue
Yep.
up on the roof of your mouth, repeat it
Yep.
enough times, and they'll get it.
Yes, absolutely.
Now
Yeah,
you put it, yeah, go
my
ahead.
my girls have come to learn that, like, breathing out of your mouth is not breathing. They've already learned you breathe through your nose. And so when they get colds and their nose is stuffed up, my 2-year-old will say, I want to irrigate my nose. And we'll give her a bottle and she'll just shoot it up there to breathe.
Wow.
So they're kind of already trained that we breathe through our noses.